Welcome back to neuropharmacology. Today we're going to talk about benzodiazepine derivatives and related drugs with skeletal muscle relaxant activity. These are compounds that have varying degrees of sedative, anti-anxiety, and muscle relaxant properties. These effects are all produced by their ability to enhance GABAergic activity in the brain. There are hundreds of drugs that fall into this category, but only a handful are widely used in veterinary medicine. The first category are grouped together based on their common benzodiazepine structure. They're used extensively in small and large animals. This category includes the classic prototype benzodiazepine derivative, diazepam, also commonly known under the trade name of Valium. In addition, there is alprazolam, clonazepam, and midazolam that have a similar mechanism of action and spectrum of use. One clear advantage of these compounds is that there's a specific pharmacologic antagonist, flumezanil, that can be used to reverse the effects of these compounds in situations of an overdose or adverse side effect. Benzodiazepines are absorbed well by any route. This allows them to be used orally as anticonvulsants, but when they're used as pre-anesthetics, they're usually injected IM or sub-Q to produce a rapid onset of action and allow the pre-surgical workup to proceed more quickly. They're also used IV for status epilepticus, as the animal frequently has stopped breathing and you need to control the seizures that are interfering with respiration as quickly as possible. In comparison, benzodiazepines have a much faster onset of sedation than drugs of the major tranquilizer category, like acepromazine. The benzodiazepines are metabolized in the liver to compounds that are active in and of themselves. But in spite of these active metabolites, the duration of action of benzodiazepines is still usually shorter than that of drugs like acepromazine. Benzodiazepines have a common spectrum of clinical effects, many of which can be summarized by the photograph of this cat. The total picture of drug effects produced is very different than that after injection of a major tranquilizer, where the animal may be sedated but retains a lot of muscle tone. This allows it to move and assume a posture, albeit somewhat cataleptic. In contrast, benzodiazepines produce a calm, even hypnotized, and limp animal that is very unresponsive to outside stimulation. When you think of benzodiazepines, think of sedation, skeletal muscle relaxation, anticonvulsant activity, and anti-anxiety activity. But up to 30% of dogs and cats become excited and dysphoric from benzodiazepines. So its use as a pre-anesthetic is restricted to neonates, geriatric patients, ruminants, pigs, and neonatal but not adult horses. The sedative effect is primarily useful as a pre-anesthetic medication when used with compounds like ketamine in some species, where that produces excitatory effects with little or no skeletal muscle relaxation. Ketamine's excitatory effects can even dominate over its anesthetic effects when it's used alone. The commercially available preparation called tilazol is a benzodiazepine, zolazepam, combined with thalidomide, a relative of ketamine that's covered in the dissociative anesthetics videotape. The anticonvulsant activity is so pronounced that these drugs have been used in some animals prophylactically as compounds to prevent seizures in feline patients with epilepsy. Their duration of action is too short in dogs to be used in a similar fashion. The general anticonvulsant effect of diazepam makes it an important drug to use in cases of status epilepticus, that is, uncontrollable, life-threatening seizures of unknown etiology. However, other compounds like propofol are preferred when they're available. The skeletal muscle relaxant effect of benzodiazepines allows you to treat cases of tetanus and strychnine, conditions that are characterized by strong extensor rigidity. During surgery for fractures or massive tissue damage, these drugs also allow you to retract and repair torn muscle and ligaments because of their strong skeletal muscle relaxant properties. The effects of these drugs on mental status is referred to as anti-anxiety or anxiolytic activity. This has a specific definition in human medicine referring to anxiety as a specific mental disorder. The same may be true in veterinary medicine. However, the successful use of these drugs for behavior modification or for transporting animals, shipping pigs, or mating mink is probably linked to their sedative effect as much as their anti-anxiety effect. Finally, diazepam can stimulate the appetite for a short period of time in animals that are off feed. There seems to be a strong development of tolerance to this effect, so you can't depend on it for protracted periods. A week to 10 days might be the optimum time. Major tranquilizers like acepromazine and minor tranquilizers like diazepam derive their classification from their use in human medicine. Although both types of compounds are used widely in veterinary medicine and often for the same purpose of sedation, sedation is actually a side effect in human medicine. In psychiatry, phenothiazines are more likely used for psychoses, whereas benzodiazepines are used more for neuroses. Psychoses involve an excessive dopaminergic neurotransmission, and that dopaminergic activity can be inhibited back to normal by treatment with major tranquilizers like phenothiazines. The full spectrum of neurotransmitters involved in the production of a neuroses isn't yet clear, but it's not exclusively dopaminergic. Benzodiazepines and other drugs that are used for neuroses in human medicine are also used for their muscle relaxant properties in humans as well as in veterinary medicine. So both neuroses and psychoses can be treated successfully, but with a different type of drug. The terms major and minor with respect to tranquilizers are actually not used anymore in human medicine. Instead, they're referred to as antipsychotic and anti-anxiety drugs. But in veterinary medicine, we're not treating psychoses and neuroses as much as exploiting their sedative side effects. It would be more accurate to refer to them as depressants with either phenothiazine or benzodiazepine type properties. But remember, you might encounter human meds as a potential source of toxicity when they're left sitting around on the coffee table, for example. So what are the adverse effects produced by the benzodiazepine type drugs? Usually these drugs can be used safely for both sedative as well as hypnotic effects with little or no cardiovascular or respiratory depression, a major advantage for anesthesiology. But you should be aware that they may cause a transient apnea, that is a cessation of breathing when injected rapidly because of the sudden high concentration in the respiratory centers. And you shouldn't try to use them alone as anesthetics because high doses do not produce a good quality anesthesia, and at the same time, it can produce a dangerous depressive effect for both the cardiovascular and the respiratory system. They're safe when they're used as part of a balanced anesthesia. One important thing to note is that in spite of the sedative and anti-anxiety effects of these drugs, they have no analgesic activity. So if you plan on doing a painful procedure while the animal is sedated, you need to be sure that another compound with analgesic activity is used, either systemically like an opioid or locally like a local anesthetic. Sometimes when injected into horses or dogs as a pre-anesthetic drug, the potent muscle relaxation effect may precede the sedative effect, resulting in a very marked ataxia. This can be disorienting for the animal until the full effect of the drug takes place. For this reason, it's not usually used in adult horses as a pre-anesthetic. If the animal is excited, you may not be able to reverse that effect and produce sedation. In addition, some animals always experience an idiosyncratic excitatory response to benzodiazepines. Instead of sedation and anxiety, the drug causes basically an inebriated state, so the animal appears ataxic and disoriented. In this case, no amount of diazepam or other benzodiazepine will produce a sedative effect in these animals, and a note should be made in their charts that they respond this way because subsequent injections usually produce the same response. Let's say that an animal is brought in for a surgical procedure and you administer diazepam as part of the anesthetic combination because the animal has a history of epilepsy. If this is a dog who's been treated for years with phenobarbital, you probably will see less sedation than in a naive animal because there's cross-tolerance to the sedative effect of benzodiazepines with those of barbiturates like phenobarbital. So it simply means that a larger dose of the drug needs to be administered to achieve the same degree of depression. There's also cross-dependence between most depressant drugs like the barbiturates, alcohols, and benzodiazepines. In other words, there's a characteristic withdrawal from these compounds because the brain has become dependent on their presence for normal activity. And many of these depressant drugs can be used to replace the original drug that caused the development of that depressant state. Withdrawal from benzodiazepines involves seizures and can be lethal. So if you administer too much of a drug of the benzodiazepine category, or if the animal ate its owner's pills, what might you do? The drug flunazepam is a competitive antagonist at the same receptor as the one with which the benzodiazepines interact. Injection of flumezimnil will either prevent or reverse the effects of diazepam-like drugs. However, if you have an animal that's highly dependent on benzodiazepine, for example, after long-term treatment of an epileptic condition, the injection of flumezimnil can cause withdrawal seizures. How do benzodiazepines produce their sedative, anticonvulsant, and anti-anxiety effects? Basically, they enhance GABAergic activity. GABA is one of the most important inhibitory neurotransmitters in the brain. When it's released, GABA interacts with receptors located on a chloride channel. When GABA binds, it causes the 5 membrane-spanning proteins that make up this channel to open and allow chloride to flow through, producing a hyperpolarization of the membrane. That is, it's inhibitory. Benzodiazepines don't bind to the GABA binding site. Instead, they bind to a site between the alpha and gamma proteins, whereas GABA itself binds to a site between the alpha and beta proteins. When GABA and diazepam bind to these two different sites on the same channel, benzodiazepines merely enhance the sensitivity of the channel to GABA by an allosteric, or that is a distant mechanism. As a result, benzodiazepines increase the frequency of the opening of the channel in response to GABA. There are several other sites on this same chloride channel where other drugs like ethanol or volatile anesthetics and barbiturates can bind, they also enhance the activity of this same channel, but by binding to different receptor sites. The difference in the location of their receptors gives each one a slightly different modulatory effect. There are 2 alpha proteins and 2 beta proteins and 1 gamma protein that make up the channel. The amino acid sequence of each of these proteins varies throughout the brain, resulting in a variety of subtypes. GABA receptors with the alpha 1 subtype are largely responsible for the sedative, anticonvulsant, as well as amnesic effects of these drugs. In contrast, the GABA receptors with the alpha 2 subunit are responsible for the anxiolytic, that is, anti-anxiety, and muscle relaxant effects of these drugs. So although all of these drugs tend to have the same sum of each of these 2 effects, because they have different affinities for receptors on these subunits, they tend to produce a slightly different constellation of effects. How does this influence the actual clinical use of these drugs? All of them are used in dogs and cats on an off-label basis. Amongst the currently available drugs, some are better sedatives, while others are better anti-anxiety compounds. Diazepam, for example, the prototype, is the least selective, so it's used for all of the effects produced by benzodiazepines, but others may be preferred for certain situations. Alprazolam, Xanax, and clonazepam, Klonopin, are used a lot for anxiety disorders because their action on alpha 1 subunits predominates. In contrast, midazolam, Versed, and zolazepam, which is a mixture of talidomide and tilazol, are each more sedative and have strong anticonvulsant activity due to their action on alpha 2 subunits. So they're more frequently used as a pre-anesthetic. All of them can be used in an emergency for convulsions. However, tolerance to their effects develops and their tolerance differs. So most are not used on a long-term basis. In the next segment, we'll examine additional drugs that are used primarily for their muscle relaxant activity, but by mechanisms that don't appear to involve benzodiazepine receptors.